Hi, my name is Lindsay, and I'm going to be demonstrating an assessment on a newborn. The first thing we're going to start off with is vital signs, and I'm going to assess the baby's respirations for a full minute. Okay, and for this baby's respiration, I got a rate of 38 in 1 minute, and the normal's 30 to 60, so she's in good standing. Next, I'll assess the heart rate by auscultating the apical pulse for another full minute. Okay, and for this baby, I got a heart rate of 122, which the normal range is 120 to 160, so that's good as well. For the baby's temperature, I'm going to check under the arm. I'm going to get an axillary reading here. And the baby's temperature is 97.8, which is in the normal range. Okay, so for my head to toe assessment, I'm just going to start at the top and work to the bottom. The first thing I'm going to do is assess the head. We're looking at the fontanelles of the baby. In the front is a diamond-shaped fontanelle, and the back is triangular. And we're looking to make sure that these are not depressed, which could indicate dehydration, or over-distended, which will indicate intracranial pressure. We're also looking at the suture lines. We're making sure that they are not fused, in which these have some gapping, so that's good. On some babies, you may notice a caput or a hematoma, which is normal, but this baby does not have either, and she's got a nice round shaped head. Next, we'll look at her eyes. And what I'm going to do is look at her pupils and make sure that they both constrict symmetrically to light, which they do. I'm also going to check that she blinks. The baby does that. And we're also looking at the whites of the eyes, or the sclera. If they're yellowed, it could indicate jaundice in the baby. Also, you'll want to check for the red reflex. And to do this, we will turn off the lights and use our pen light. And the baby should have symmetric red points on their eyes. To check the color of the baby, we're looking for jaundice once again, which you can see that this baby has some yellowing of the skin. And a good way to check for jaundice is to just press lightly on bony prominences on the body, starting with the forehead and the nose, the chin, and the sternum, working your way down. And when you depress these, if there's a yellow tone, that indicates jaundice. You're also looking for bruising on any parts of the body, which around the head area I do not see any, so we'll check for bruising as we move down the body too. Acrocyanosis is something that's common in newborns. That's bluing of the hands or the feet. Doesn't necessarily indicate that they're cold. We're also checking for a Harlequin sign, which is redness on one side of the body, which this baby is absent for the Harlequin sign, and erythema toxicum, which is like a little flea bite, and that will disappear within days or hours. Sorry. Also, we're going to look at the position of the ears. The ears should be in line with the outer canthus of the eye. If they are further down or not in line with the outer canthus of the eye, it could indicate chromosomal abnormalities. You're also just looking at the shape of the ears, seeing if they're symmetrical. You'll want to note any skin tags or any drainage from the ears. Also, you'll want to look at the nose. To check the patency, you'll put a glove on, and you're putting your finger in the baby's mouth and occluding one nostril at a time to make sure that baby is still breathing, which she is. Also on the nose, you might note some what they call milia, which is just small little whiteheads. These are normal, and you do not want to attempt to pop these or get rid of them. They will disappear on their own. Also, you're obviously looking at the shape of the nose, making sure it's looking symmetrical and that there's no problems with the breathing. For the mouth, we'll want to look at the palate, and to do so, once again, we'll want to use a glove, and you're just feeling inside the baby's mouth on the upper palate to make sure that it's intact, which is good. You're looking for a pinkish color, making sure that it is it's moist. You're looking at the gums and all around in the mouth. You might find Epstein pearls, which are little white yellow spots on the gum. And then you're also looking for a tongue tie. Next, moving on down the body, we're looking at the neck. We're making sure it's short with some skin folds, making sure we don't notice any abnormalities there. Okay, so after examination of the neck, we're going to go ahead and move on down to the arms. First, I'm going to assess the brachial pulse, and you'll assess that for a full minute and make sure that it's palpable on both arms. Once again, check for the acrocyanosis, which is bluing of the hands. You're checking to make sure baby has all 10 fingers and making sure they're not webbed. This baby has all 10. And you're making sure that movement of the arms is symmetrical. Now looking at the chest, you'll want to note the shape of the chest. And you'll also note that expansion of the lungs is symmetrical for the baby. You're also looking at the breast buds, which you may note in male and female that they may be slightly enlarged. And you may also notice some drainage from the nipples, which is normal. That's due to mom's hormones. And the best place to check capillary refill on an infant is the chest. You're just depressing the on the sternum lightly and then checking for capillary refill under 3 seconds. Next, I'm going to auscultate the lungs. Make sure to auscultate the whole lung field for the baby. may notice that lung sounds were mostly clear with some crackles, which is normal for infants as they're still trying to get their lungs to fully develop. Let's see. We already addressed the apical pulse. You'll want to feel for its strength, and you may notice that the beat of the baby's heart is irregular, which that is completely normal. And you may also notice murmurs, which is normal as well in infants. This baby has no murmurs, so we're good there. Moving on down, I'm going to go ahead and undo the baby's onesie to check out the abdomen, which we may notice that it is somewhat distended. Newborn. This is normal in a newborn. We're looking at the size and the shape of it. We are also going to listen for bell sounds. And in all four quadrants, we note that the bell sounds are active. You'll also want to look at the umbilical cord, and you'll want to check for the 3 vessels and make sure there's no redness or drainage, which may indicate infection. You'll also want to make sure it's clamped down well and that it's clean and dry. For the groin area, we're assessing the femoral pulses. I want to make sure that it's palpable on both legs. And then to assess the genitourinary system on the female, which is what we have here, we will undo the diaper. And we will note the appearance of the genital area, which it's common for some swelling to be in there. It's also common for some discharge that's either white or you may notice red, which is referred to as pseudomenstruation. And these are just hormones still from the mom that baby has yet to process. And you may also notice with the urine that there's some uric acid crystals. These are normal, and they may be a brick red color and look like kosher salt. Once again, these are normal. You're checking for meconium stool, and that will indicate that the rectum is patent. Let's see, we can replace the baby's diaper here. For baby's hips, you want to make sure that they rotate and flex equally and that there's no clicking, that there is a smooth motion and full range of motion. As we've gone along, I've been assessing the skin. We're making sure that it's somewhat dry, and you may notice cracks or peeling on the baby. These are normal findings as the baby is drying out from being in amniotic fluid for so long. Once again, you're also checking for bruising of the skin. Lanugo, which is fine hair along the baby, is normal, which the baby has just a little bit on her arms. And we will go ahead and assess the back as well. And while you're assessing the back, you can undo the diaper and look for Mongolian spots, which will be found on the lower back or the bottom area. The dark spots found there, which is normally not found in Caucasian children. Also on the skin, you're looking for any abnormal marks like birthmarks. There's all different kinds of birthmarks. You're looking for a stork bite, which may be on the forehead or the nape of the neck, the port wine stain, or the strawberry looking birthmarks, which will be raised. Okay, moving on, we're going to assess the neurological parts of the baby. Get baby covered up here. You can startle the baby and make sure that the baby has a strong cry. And you can do this simply by tapping the side next to the baby or tapping on the baby's feet. Okay, and I am going to assess the baby's cry just by simply startling it. This is also checking for baby's hearing. And once again, you're just checking for a strong, lusty cry of the infant. The next thing you'll want to do for neuro checks is checking the baby's reflexes. To check for a sucking reflex, you're simply going to glove your hand and stick it in the baby's mouth. The baby should automatically have a sucking reflex. You can also do rooting, which is just simply stroking the baby's cheek by the mouth, and the baby should turn to the side that you have gently stroked. For the moro reflex, we're going to pick up baby and imitate a dropping motion. The baby's arms and legs should flare out, and you'll notice a little C shape in their thumb and forefingers, and then they will return back to their normal state. For the plantar grasp, you're going to let the baby grasp onto your fingers. Each hand, they should automatically grasp it. And then for the plantar grasp on the feet, we'll check both feet. You just press lightly on the balls of their feet, and their toes should curl over your fingers. Do that on both sides. The Babinski reflex, for infants, you'll do an upside down J shape, and their toes should fan outward. The last thing we're going to check is the spine of the baby. We're making sure that baby has a straight spine, and we're checking also for sacral dimples. Once we've assessed that, make sure baby has all 10 toes. And we have ended at the feet, and that is a neonatal assessment.